This is your Mecklenburg Minute. We're looking back at 1 year ago when the first cases of COVID-19 were discovered locally and how we continue to manage through the pandemic.
Unbeknown to anyone, life in Mecklenburg County was about to change.
Are presumptive positive for COVID-19.
If the current state continues, we could see the number of cases double every 4 days in the state of North Carolina.
That we do not institute this order lightly.
We felt we needed to lead and be a little bit ahead of the governor because we were concerned about what we were seeing here in Mecklenburg County.
We are watching the situation in our community day by day.
We had stay-at-home orders, testing, and the 3 W's.
The constant change, changes in guidance, changing in information, changing in understanding of the virus and how it affects our communities, and trying to help people understand the need for all those changes.
Things must look a little different this year.
We moved many services and meetings online and got creative working from home.
What are the name of the chess pieces?
Well, that's an excellent question.
Essential workers reported to work in the field and at the Emergency Operations Center.
With the support of our IT department and HR, we were able to transition to a virtual government incredibly quickly, and our staff responded. They continued to provide services without skipping a beat. And I think if you look back from a year from now, I don't think there's anybody who could say that they didn't get a critical service that they needed.
The case investigation and the contact tracing that we've been able to do, the systems that we've been able to set up, that has been, getting that in place and moving forward was a big milestone.
And now we are talking about vaccine appointments.
Someone asked me the other day if I saw the light at the end of the tunnel, and I told them I saw a glimmer. There is some light there. It's pale right now, but it's coming. And I do think that the vaccines are going to make a huge difference.
I mean, that's a game changer, and the more people we can get to get vaccinated, the easier it will be for us to open up. And so what I see is, us being able to return to normal, hopefully over the next few months, but really still focusing on those individuals who still have that vaccine hesitancy, the disproportionately impacted populations that may not be reached. So I think that's the area where we're going to be working for several months to make sure that nobody gets left behind.
COVID-19 changed our daily lives and showed us our resiliency.
Collectively, everybody who sat at our table for the whole year can be proud of what we've accomplished.
With your Mecklenburg Minute, I'm Pamela Escobar.